Yeah, hello, Namaskar. I'm Dr. Dinesh and I'm going to discuss pharmacology. CBT 1 question we are going to discuss in this. So let's start with the question number 1. 10-year-old child. If you see the age of the child is 10 year, it means young children. Presenting with the brownish discoloration and deformed anterior teeth. Having the history of taken antibiotic about 4 years earlier. So there is a history that this child has taken the antibiotic. So most probably this antibiotic is causing this problem. Which antibiotic could be responsible for this condition? The options are, these are A, B, C, D. The options are chloramphenicol, tetracycline, erythromycin and gentamicin. Out of these, which antibiotic is causing this problem? So chloramphenicol does not cause any problem in the teeth. It is causing aplastic anemia. Tetracycline, yes, it can cause the problem in the teeth. So with the teeth, tetracycline causing problem. That's why it should not be used in the children. It should not be given in the pregnancy. It should not be used in the lactating mother as well. So tetracycline is not safe in these children. Erythromycin is safe. Gentamicin is again does not cause any tooth discoloration, etc. That is one of the aminoglycoside nephrotoxic drug. So tetracyclines are basically creating this problem. We should avoid using tetracyclines in children. Next question. Read the question. 28-year-old man with allergic cough and cold. So there is allergic cough and cold has been treated with different antibiotics on several occasions. So this patient is having allergy, so secondary infections are commonly seen. Now taken the antibiotics on several occasions. During the course of one such treatment, he developed severe diarrhea and was hospitalized. All of the following are true about this except. So basically it's a case of antibiotic associated diarrhea. It's a case of antibiotic associated diarrhea. So antibiotics can cause diarrhea. See one by one. The first option is amoxicillin associated diarrhea. It could be there because amoxicillin is one of the antibiotic. Amoxicillin and ampicillin. These are the penicillins which are commonly causing diarrhea. So that is true. E. coli superinfection is the most common cause. That is false. The most common cause for superinfection is not E. coli. That is Clostridium. That is Clostridium difficile. Clostridium difficile bacteria is the main cause. Vancomycin used to treat this via oral route. Yes, that is also true. We have the three important antibiotic for treatment. The first antibiotic for treatment will be fidaxomicin. So one is fidaxomicin, one is vancomycin, and one is metronidazole. These are three antibiotics we are using for the treatment. Overall best is fidaxomicin. Symbiotics used to prevent this risk. Symbiotic is basically the combination. So that is also true. It's a combination of probiotic plus prebiotics. So we use the probiotics in which we give the bacteria, healthy bacteria. Prebiotics are the fibers in which the bacteria will grow. So this combination is called as pro plus prebiotic is called as symbiotic. So that is very good for the treatment of this condition. E. coli infection is most common. No, that is not true. The most common is not E. coli. The most common will be Clostridium difficile. Next question. 38-year-old diabetic women present to your clinic complaining of burning micturition. While P. On examination, you observe thin grayish white vaginal discharge, which is associated with the foul smelling fishy vaginal odor, and vaginal itching is also there. Fishy odor, grayish discharge, burning micturition. So which vaginal suppository should you give to cure this infection? So diabetic female having grayish white vaginal discharge, burning micturition, fishy odor. So this is a typical case of B. vaginosis. It's a typical case of B. vaginosis. Why it is not fungal? In fungal it is not thin. It is the thick, curdish appearance. It is not the thin discharge. It is the curdish appearance. In this fungal infection, you will not see the burning micturition. That is not common. And you will not see the fishy odor. Right? So fungal smell is different. So in all these, B. vaginosis is the diagnosis, and the treatment for this will be metronidazole. In fungal infection, vaginal candidiasis, when the curdish appearance, whitish curdish appearance, then we use the clotrimazole. And next question, an elderly woman who is chronic smoker diagnosed with lung cancer has abnormally low serum osmolality and hyponatremia. After lung cancer, there is abnormal osmolality and hyponatremia. So this is due to lung cancer. This patient is having serum osmolality is low and hyponatremia. It means water retention is there. So there is water retention. Hyponatremia is there. So there is dilutional hyponatremia. So this is called as SIADH. So inappropriate secretion of antidiuretic hormone. If ADH excess is there, that is called as SIADH. So what drug you will use for treatment of this condition? So in SIADH, which drug you will use? One by one, terlipressin, that is the V1 receptor agonistic. That is the drug used for controlling the bleeding in the esophageal varices. Furosemide is one of the loop diuretic that is used for hypernatremia treatment, edema. Tolvaptan is the ADH antagonist. And it can be used to treat the SIADH. So tolvaptan is the drug for SIADH, that is the drug of choice. Amiloride is used for lithium-induced diabetes insipidus. It blocks the ENaC, epithelial sodium channel. In SIADH, the main treatment is water restriction with hypertonic saline. We give the 3% saline, hypertonic saline in the treatment. But if the patient cannot be managed by the hypertonic saline, then tolvaptan, conivaptan like drugs can be used. These are the ADH antagonists. They are also approved for CHF patients. Next question. Which combination of the seizures and its first line treatment is false? Which combination of seizures and it is first line treatment drug is false? So let's see one by one. Absent seizure, ethosuximide, which is a T type of calcium channel blocker, that is true. That is the drug of choice for absent seizure. Myoclonic seizure, topiramate, that is false. Topiramate is not a first line drug for myoclonic seizure. For myoclonic seizure, the first line drugs are valproate, lamotrigine, and very important is levetiracetam. These are the drugs we use for myoclonic seizure. Valproate, lamotrigine and levetiracetam. In myoclonic seizure, never use phenytoin, never use carbamazepine. These are having the paradoxical effect. Seizures may appear. Then focal seizure, levetiracetam, that is true. For focal seizure, again levetiracetam, lamotrigine and carbamazepine. These drugs are first line drug. In generalized seizure, valproate, yes, valproate, lamotrigine, these are the first line drug. So all are true except myoclonic seizure, where topiramate is not a first choice. Next question. A female which is presenting with the pain and redness in her greater toe. Serum uric acid level. See the serum uric acid level, it is 9.7, that is high. Apart from analgesic, one more drug was prescribed to treat the formation of uric acid was decreased. So one drug was given analgesic to control the pain. The another drug is to control the uric acid level. So for this, the drug is decreasing the uric acid level. So the action is decrease the formation of uric acid, synthesis of uric acid. So which enzyme is likely to be inhibited by this drug? So the drug we are using is allopurinol. The drug we are using is the allopurinol or febuxostat. So axostat, xanthine oxidase inhibitor. So which enzyme? So out of the xanthine oxidase enzyme is blocked by these drugs. Dihydrofolate reductase, that is for methotrexate. Thymidylate synthetase, that is for 5-fluorouracil, anti-cancer medicine. Phosphoribosyl transferase, that is for bisphosphonates. Bisphosphonates are the drug for osteoporosis. So out of this, xanthine oxidase inhibition is true about the gout patient. They are the drug of choice for gout. Next, an elderly patient came with the features of Parkinsonism like rigidity, hypokinesia, etc. It is extrapyramidal disorder, substantia nigra is involved, dopamine degeneration is there. Which of the following is not prescribed to this patient? Let's see one by one. Safinamide is one of the MAO-B inhibitor, and definitely MAO-B inhibitors are inhibiting the dopamine metabolism. They can be used. Ropinirole is the dopamine receptor agonist. Dopamine receptor agonists like ropinirole, pramipexole, they are the important drug. They can be prescribed. They are the good drug in the Parkinsonism. Levodopa plus carbidopa, dopaminergic drugs. Levodopa plus carbidopa is the most commonly prescribed drug. It is the most commonly prescribed drug. Donepezil is the drug which is cholinergic drug, central cholinergic. It is the central cholinergic drug. It is for dementia. It is for dementia, not for Parkinsonism. It is used in the treatment of dementia, not the Parkinsonism. So important drug. For dementia, we use the donepezil rivastigmine. Rivastigmine is the drug which is available in the patch. Donepezil is tablet. Rivastigmine is the good drug for this. Next question. A patient who is suffering from rectal cancer and was on chemotherapy develops profuse diarrhea. You know, one of the common side effects of chemotherapy is diarrhea. Which of the following should start first to control this diarrhea? So chemotherapy associated diarrhea. The first drug we use in this patient is loperamide or diphenoxylate. Means we use the opioid. Loperamide or diphenoxylate like drugs. These are opioid. The second important use, octreotide. Then we can use the resicadotril. WHO ORS plus zinc. All these things we provide to control this diarrhea. Out of these, the first and most important drug is loperamide. Ofloxacin, there is no need of antibiotic. Atropine can be combined with the diphenoxylate, not used alone. Octreotide, loperamide can be used, but out of these, the first drug will be loperamide for chemotherapy associated diarrhea. These are the drugs we use for diarrhea in the chemotherapy patients. Next question. 32-year-old women present to your clinic for routine physical examination. Overall, she felt well and has no complaint. She has no past medical history other than tobacco use. She is saying that she has been smoking 1 pack of cigarette a day for the last 10 years. It's a chronic smoker. You strongly encourage her to quit the smoking, and she seems willing to try to stop the tobacco or smoking. You also offer to prescribe her a medication that is showing the effect in smoking cessation by acting as a partial agonist at nicotinic receptor. Which drug is this? So basically asking about the anti-smoking drug which act as a partial agonist at nicotinic receptor. See, we can use nicotine, vernicillin, clonidine for this purpose. Chlordiazepoxide is used for alcohol patients, alcohol dependence. It is one of the benzodiazepine drug. But rest of the 3 drugs can be used for anti-smoking. But out of these, which is partial agonist at nicotinic receptor, that is vernicillin. Vernicillin is partial agonist at nicotinic receptor. Alpha 4 beta 2 receptor, partial agonistic receptor. And it is the best drug for anti-smoking purpose. Best drug. Nicotine can be used as NRT, nicotine replacement therapy, but that is not a partial agonist, that is the full agonist. Clonidine is alpha 2 agonist. Alpha 2, central sympatholytic. Decrease the risk of smoking. But vernicillin is the best drug. One is vernicillin, one is NRT, clonidine, bupropion. These drugs we are using for anti-smoking purpose. Next question. Question number 10. A 48-year-old woman was brought to the emergency department because of serious breathing difficulty. 2 hours earlier, she had been taken a drug for headache. One drug for headache. The patient has been suffering from sinusitis as well, nasal polyps as well for the 6 months. Physical examination is showing the severe bronchospasm. Which of the following drug is most likely causing this patient's signs and symptoms? So see bachche, the one is serious breathing difficulty, asthma, one is sinusitis, and one is nasal polyps. These histories are there. So which drug causing this problem? So if there are three important symptoms, nasal polyps and sinusitis, first. Second is bronchial asthma, breathing difficulty, and aspirin allergy. Aspirin allergy. These three are called as Semterstride. Semterstride. What are the three important things? Nasal polyps, asthma, and aspirin allergy. These three, nasal polyps, asthma, and aspirin allergy. These three are important. These three are important. Semterstride. So this patient most probably has taken the aspirins, acetyl salicylic acid, that is worsening the asthma, and also there is history of sinusitis, nasal polyp. These patients are having intrinsic asthma, allergic intrinsic asthma. Normally allergic asthma is extrinsic asthma, but aspirin allergy is intrinsic asthma. Intrinsic asthma, aspirin allergy, nasal polyps. Typical case of Semterstride, aspirin, acetyl salicylic acid. Acetyl salicylic acid. Next, a pregnant lady was given indomethacin, one of the NSAIDs, COX inhibitor, in 26 weeks to treat the arthritic pain. What it could lead to in the pregnancy? NSAIDs are not safe in pregnancy, only the paracetamol is having some safe role, and that is also not the high dose. So if you give the indomethacin, NSAIDs decrease the prostaglandin. What is the risk of these NSAIDs in the pregnancy? They can cause the premature closure of ductus arteriosus. See the options. Patent ductus arteriosus, no. They cause the premature closure. To maintain the patency, prostaglandins. These are prostaglandins inhibitors. Because they inhibit the prostaglandin, so they can cause the premature closure. Premature closure of ductus arteriosus, premature closure of ductus venosus, not venosus. It is ductus arteriosus. PDA closure, not foramen ovale. The premature closure of ductus arteriosus seen due to these drugs. If it is not closed, you want to close it after birth, then also we use the NSAIDs. And the best is ibuprofen. Indomethacin is strong, ibuprofen is best, safe option. So in pregnancy, this is the risk. Next question. This drug combats acromegaly by acting on somatostatin, a growth hormone inhibitor. So basically it's a somatostatin analog used for acromegaly, and it's a growth hormone inhibitor. Which drug is this? So let's see. Octreotide is a somatostatin analog. It is a growth hormone inhibitor. GHIS, growth hormone inhibitory hormone, and it is used for acromegaly. Seems to be true. Pegvisomant, it is polyethylene glycolated form. Polyethylene glycolated form used for growth hormone receptor antagonist. Growth hormone receptor, directly targeting the receptor, growth hormone receptor antagonist, but it is causing visual problems. It is causing visual problems. So it is not a somatostatin analog, it's a growth hormone receptor. Sodium iodide 131, that is used for thyroid malignancies, radioactive iodine, iodine 131. Desmopressin, that is V2 receptor, vasopressin, that is used for nocturnal enuresis, bedwetting in children. For that purpose we use. So octreotide is the drug out of this which is used for acromegaly. Pegvisomant can be used, but that is growth hormone receptor antagonist, visual risk is there. Octreotide can be used. One more important drug, lanreotide. Lanreotide is available in the depot injection, and that is preferred nowadays. Lanreotide depot injection, that is preferred. But octreotide, lanreotide, both are correct answer. So that is for acromegaly management. Next question. Which of the following anti-diabetic drug is associated with osteoporosis risk in type 2 diabetes patients? Anti-diabetic drug associated with osteoporosis risk in type 2 diabetes. So first we need to see which is used for type 2. Metformin biguanide type 2, empagliflozin type 2, glipizide sulfonylurea type 2, liraglutide is GLP-1 type 2. So all these drugs are used for type 2 patient. This drug is associated with the osteoporosis. There are two main drugs which are associated with the osteoporosis in the diabetes. The most important is pioglitazone. Pioglitazone is not in the choice. The second important is gliflozins. These two drugs are found to be causing the osteoporosis. Pioglitazone is having more risk, but not in the choice. The newer drug is gliflozin, which is having this risk. So out of these are not the answer. It is the empagliflozin which is having the risk of osteoporosis. Till date, the fractures are not reported, but with pioglitazone, even the fractures have been reported. So if option pioglitazone is there, that is the correct answer. But not there, then gliflozins are having the risk. It is the recent update. Next question. Which drug name is not a generic name? So bache, there are two type of name. One is generic name, which is non-proprietary, and the another name is proprietary name, that is brand name, or which is the proprietary name, proprietorship. So brand name or proprietary name. Whatever name we are discussing in the class, whatever name you are discussing, you are studying in the books, they all are generic names. Brand names are given by the pharma companies, and these you will learn in the practice. Okay, which brand is good? Atropine, Valium, Ipratropium, Hyoscine. These names are there. Atropine we listen. In the books we study. Ipratropium, bronchodilator. Hyoscine, used for motion sickness. All these we know. These are generic names. But Valium, if we don't know. That means it is not a generic name. It's a brand name. Valium is a brand of benzodiazepine, diazepam. Diazepam is the generic name of Valium. Diazepam is available with the different generic names. Diazepam is available with the different brand names. Valium is one of the brand of diazepam. The generic names are universal. Brand names could be multiple. Every pharma company will give the different brand name, but generic names are universal. Next question. All of the following hormones have cell surface receptor except adrenaline. It is acting via alpha beta receptor. It is GPCR. That is cell surface receptor. Growth hormone, that is acting via Janus kinase, and that is enzymatic receptor, and that is also outside the cell surface. Insulin acting via tyrosine kinase receptor, that is also enzymatic, so that is also not intracellular. Thyroxine is intracellular nuclear receptor, so it is not cell surface, it is intracellular. Rest of these are extracellular, it means they are on the cell surface. So you can say on cell surface means outside the cell, intracellular means inside the cell. Out of this, thyroxine is intracellular, not outside. Next, 68-year-old patient, man, present to the emergency department with acute heart failure. You decide that this patient requires immediate drug therapy to improve his cardiac functions. Immediate drug therapy. So this patient is having acute pump failure, and we want to give the immediate drug therapy to improve the cardiac function. Which of the following drug would be most beneficial drug in this patient? Options are albuterol, that is a salbutamol, beta 2 agonist. Beta 2 does not have any effect on the heart. It is beta 1 which is having the effect. Dobutamine is a beta 1 agonist, and that can be used for acute pump failure. It is available in IV infusion form. It can be used for this purpose. Epinephrine is acting on all the receptors, all alpha beta receptors. It is not a selective drug. Risk of arrhythmia is very high. Because of risk of arrhythmia, we don't use epinephrine in these heart patients. Norepinephrine can also have beta 1 action, but again it is not selective for beta 1. It is having the alpha action. It is a good drug to increase the BP because alpha receptor dominance is there. It's a drug for hypotension. So if hypotension is there, shock is there, norepinephrine is a good drug. Epinephrine is good for CPR, but dobutamine is the drug used for this purpose. In pump failure, good inodrop, there are two drugs, dobutamine and dopamine. Again, dopamine is having risk of arrhythmia, but dobutamine there is no risk of arrhythmia. That is most preferred drug because it is selective for beta 1 in these patients. Acute pump failure, dobutamine is the first choice. So these are the questions we have discussed for CBT. Thanks for listening. Thank you. Bye bye. Take care.